Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Welcome back to the Zakat Forum International Webinar. So I am Randi Swandaru, and I will be your host today for these sessions. For your information, this is the third sessions of the World Zakat Forum International Webinar. For you who want to watch the previous sessions, you can go to the YouTube channel of Baznas TV, and then you can find it there. And today we have two honorable speakers, and we are going to talk about facing the consequences of the COVID-19, a story from Zakat Institutions in Africa. So let me introduce myself. My name is Randi Swandaru. I am the head divisions of Zakat Utilizations in Baznas. And there are two honorable speakers now. The first one, I will introduce you Madam Yasmina Francke, the CEO of the South African Nation Zakat Fund. Assalamualaikum, Madam Yasmina.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you for having us on this program.
How are you now?
Alhamdulillah, alhamdulillah. How are you? How's Ramadan?
Alhamdulillah, Ramadan Kareem. I'm good here. So the second one is the Executive Chairman Sokoto State Zakat and Waqf Endowment Commission Nigeria, Mr. Muhammad Lawal Maldoki. Assalamualaikum, Brother Muhammad Lawal Maldoki.
Waalaikumsalam warahmatullahi wabarakatuh.
How are you
in Indonesia?
Alhamdulillah, we are good here.
Yeah, Alhamdulillah, okay. Great.
Alhamdulillah. Okay, so to give you a background and context for these sessions, so globally now, there are more than 3 million coronavirus cases in the world, with more than 200,000 deaths around the world. In the Africa itself, there are Muslim populated countries that has been affected by this virus. And now we are going to talk about in these sessions how the Zakat Fund can be utilized to respond to current situations. But priorly, we will talk first about the current situations of each country, both in South Africa and in Nigeria. So, Madam Yasmina, can you tell us the current situations in South Africa? What has been happened there since the first cases founded, and then can you elaborate more about the governments have been conducted to the current situation? Please, Madam Yasmina.
Okay, Assalamualaikum, Bismillahirrahmanirrahim. So as of yesterday, which was the 26th of April, in South Africa, we have 4,546 confirmed cases. At this time, also 89 confirmed deaths. But alhamdulillah, we have 1,473 recoveries to date as well. And we started with quite a rigorous testing regime. So we have done this thus far, about 170,000 tests. So I think that those are the major statistics to note. And our first case in South Africa was declared on the 5th of March. And immediately thereafter, 10 days thereafter, our president declared a national state of disaster. And at that time, immediately travel restrictions were declared and schools were closed. So I think the reaction was quite swift, and it was important to note that because it will give us that long-term benefit, inshallah. Then on the 26th of March, we entered into a 21-day lockdown period. But that was then extended. A week ago, the president confirmed that that will be extended for 2 more weeks until the end of April. And so what would have ended on the 16th of April will now end on the 1st of May, inshallah, but not confirmed as a blanket opening. It will be a gradual and phased easing of our lockdown restrictions. And what's important to note here is that our government introduced something called the alert levels. So what will happen is, because the impact of the virus is different in different states or provinces, as we have in South Africa, so each province can, and each premier per province has the right to declare a different alert level. So we have 5 levels of alert. Currently, we are at level 5. And I think the important thing about this is that in the past, South Africans became used to this kind of level approach, because when we had water shortages and we had droughts in South Africa, we were working towards these level, and people could understand at which level certain restrictions were in place. And similarly with our blackouts with electricity and our power outages, we have a similar kind of level system. So this is something that South Africans are familiar with already. So I think this is a good approach. So what we have is a phasing of these levels. So the next level that we could move to is level 4, but it's not guaranteed for every province or every state. And then within level 4, there would be certain precautions still in place and certain limitations still in place. And then it gets eased as we go to level 3 and level 2. But the reality is that we could very easily move back up to a higher alert level. So that's important for South Africans, because it's something that the communication is easier if we understand the process. But also what we need to understand in the South African context is our economic landscape. So what's important to note is just prior to the lockdown, our economic landscape was something where we had a looming recession. Our unemployment rate was at 29%, so 1 in every 3 persons in South Africa are unemployed. And reported by Food Bank South Africa, about 13 million people are food insecure in our country. So with the lockdown, these numbers just increased because economic activity has basically been disrupted. We were downgraded by Moody's as a country just before the lockdown. And schools being closed, businesses, big and small SMMEs, major retailers also had to close their doors. And some of our big industries are manufacturing, agriculture, tourism and hospitality, those who are labor intensive, which play a very key role in our job creation, also impacted. So you can understand that it's quite concerning, whilst very necessary, because we are putting the value of life as a major priority. So some of the things that influences where we are at now is that 9.6 million children normally receive meals at school, but schools are closed now. And service sector workers like your drivers, your cleaners, your waiters, your domestic workers who live from a weekly wage, they too aren't working at this moment in time due to social distancing. And small businesses are also impacted. I think the economic impact is big, but the situation that we face is one that places the protection of life above all. And it has become a matter of survival. And it is about how we stand together as South Africans, and the government's efforts and plans to provide aid and relief is very important at this moment in time.
Okay, so you are now in the level of 5 alerts, right? Like right now?
Correct. That's
Yes.
where we're at. So just to speak about a little bit about what the government has implemented at this moment. So when the president announced that the lockdown will be extended, he also announced a rescue package. And this rescue package is quite significant because it's equal to 10% of our GDP. And it's a 500 billion rand stimulus package, which is equivalent to about 26 million US dollars. And a lot of that is to help deal with what we're going through, but also provide relief to distressed businesses, to our municipalities that must ensure that there are water supplies, increased sanitation, public transport and public facilities be sanitized in terms of the virus, but also to provide food and shelter to the homeless, and also unemployment relief, for workers and employees who are not able to pay their wages to some of their staff members, and also relief for businesses. So I think that's quite a significant stimulus package that has been announced by our government. Given the context of already struggling economy, I think what the message is that our government is sending out is that they're trying their level best to deal with a pandemic of this unprecedented nature with a package that is as equally unprecedented.
Okay, so can you elaborate more about the situation on the doctors and nurses that working in the South Africa? Do they having a lack of PPE to tackle the situations, or the government has already provided a sufficient amount of the personal protective equipment for the medical team?
Yes, fortunately, alhamdulillah. I think if you look at the fact that we've only had 89, 87, even though it's 87 too many, but 87 confirmed deaths. So from the point of view of the healthcare professionals and the response from the medical fraternity has been really well. Our government is taking care of PPE at that level. However, we find that a lot of communities and organizations such as ourselves and many other community relief organizations, as well as corporates, have come to the aid and have also supported and have done their bit in providing PPE. There is a lot going around in communities where there are handouts to the general public to ensure that they have sanitizers, to ensure that they have masks. And generally, when you speak to any organization handing out hampers at the moment, there is a special effort to ensure that there are soap included so that the beneficiaries and those who are struggling at this moment in time just to put food on their table, that they're also able to at least do the bare minimum with regards to the hygiene and health precautions.
Okay, so moving forward, as you said that now 1/3 of the South Africa now are unemployed, right? So can you explain more about your program in SANZAF to respond the current situations by utilizing the Zakat funds? What are the activities that you have been conduct to respond the situation?
Yes, so I think it's important when I mentioned the unemployment rate, it's important because many of the welfare organizations and specifically the Zakat institutions in South Africa, our focus is mostly on long-term sustainable interventions because we want to tackle that poverty. You know, the unemployment brings the poverty, it brings the inequality, and we can't keep putting a plaster on that problem. So a lot of our projects and programs is about long-term sustainable interventions because we want to get to a situation where everybody is self-sufficient and financially secure. So we tend to prioritize empowerment, development, education, and skills programs. However, with the current reality of COVID-19, it's heartbreaking to see the day-to-day suffering of the vulnerable in our country. And so we, as the South African National Zakat Fund, we have realigned our focus to the demand of the situation. So strategically, we are fully engaged in welfare relief and attending to the immediate needs. We have put all our development and our empowerment programs on hold for now, and we are concentrating on providing the basic necessities for people to survive from day to day. And so, as I mentioned earlier, we're also augmenting our food hampers with hygiene packs, which is an absolute necessity in this crisis. And then we're also doing our part in creating some awareness on the need to curtail the spread of the virus. So doing a little bit of education where we can through our social media activities, talking about what people can do to ensure that they are protected from this virus, but also importantly, you know, to add our voice to the support of government's initiatives in their education of the masses as well. So from our side, daily there are food hampers that's being distributed. We've worked with other organizations. We're also working alongside with government in collaborating with them. It's important to note that this is the kind of thing that SANZAF does on a daily basis in terms of relief in vulnerable communities. So at a time like this, government definitely need organizations that's in the trenches, that's on the ground all the time, that has the infrastructure, that has the systems and the processes to manage this kind of thing, to work together, and so that we have a coordinated response to it, and there's collaboration so duplications are minimized. So on a daily basis, SANZAF is out in the field delivering in all of our regions where we operate, delivering not only food, as in home meals for the day. So we have one of our regions that's very active every morning doing food and a breakfast at our shelters for the homeless. But we also have hampers that we distribute to families in a coordinated way so that we cover region by region and area by area. But also at this moment in time, it's coupled with the month of Ramadan. So there is this opportunity now also for Muslims, because we know this is the month of compassion and the month of giving, that we are receiving a lot of support from our Muslim community to augment our efforts in assisting with food relief at the moment.
Okay, so talking about the Ramadan, is there any differences that you have been prepared priorly to facing the Ramadan? Like last year, we don't know this is gonna be happen, but now Ramadan in Ramadan season, the busiest month in the activities of the Amil Zakat, we are having the pandemic like this. So, what the response of your management team to the current situation facing the Ramadan season?
Yes, so our work absolutely will continue during this month of Ramadan. And we, first of all, putting every precaution in place to ensure that our own staff and our team is protected and that they're safe. Yes, the social distancing issue will certainly impact the coming together at the masajids and the prayer for Taraweeh. And this is where the masajid has become the hub in the community during the month of Ramadan, and where we were also able to execute many of our projects during Ramadan. But what we are doing is to mitigate that face-to-face contact, we have moved a lot of our manual to digital programs. And so a lot of our online platforms with Zakah advocacy has gone to similar to this, webinars as well as radio and television programs. What we've also done is we've launched a Zakah app for the month of Ramadan now to coincide with the beginning of Ramadan. And the app not only helps educate, but it has also an opportunity for the Muzaki to help calculate the zakah, but also we've all gone virtual with our Fitra and Fidya collections, which we will be adding to our digital payment portals. And so a lot of what we've done before, which was mostly physical in terms of physical collection points, we've gone digital, and we've opened up quite a few platforms for our Muzaki that supports the South African National Zakah Fund to pay their Fitra and Fidya and Zakah online. So at this point in time, as always, our appeal do go out that, not just for COVID-19, but also we know we have Zakat al-Fitr, and that we have an obligation to ensure that every Muslim is able to have some kind of celebration, although we know it's going to be in a different form altogether this year, but some kind of celebration at the end of the month of Ramadan. And last year, SANZAF had a target of 23,000 hampers that we did, and this year we believe the need is going to be greater because there is an increased category of mustahik that has come into play, and those are middle income market that under normal circumstances would have been able to care for themselves, but now due to maybe job losses and kind of layoffs, that we foresee that the need is going to be bigger this month of Ramadan.
Okay, so as you said that you already swift from the manual to the digital campaign to respond these current situations. Okay, thank you, Madam Yasmina. So we are going to Mr. Lawal Maldoki, but first for you who watch this video, You can ask your questions. You can type your questions in the comment sections, and we will read your questions and deliver to the speakers right after this session. So we go to the Mr. Lawal Maldoki. Brother Lawal, are you there?
Yeah, I'm with you, brother Randi.
Okay. So, Brother Lawal, can you explain the current situations in Nigeria, or maybe much wider in the West Africa? What is the current situations there regarding the pandemic of COVID-19?
Well, Bismillah ar-Rahman ar-Rahim. Alhamdulillah wa afdal salatu wa atamu taslim ala Sayyidina Muhammadin wa alihi wa sahbihi wa sallim. I greet you with the best form of greetings and say Assalamu alaikum wa rahmatullah. We are really delighted for being invited to join you in this very important discussions to enrich our knowledge on the current situation and what our colleagues are doing world over, and also the little that we are doing with the respect to the COVID-19 that is ravaging many countries. In Africa, we have our own share, and it is really not an easy issue because about 52 countries of the African continent has been affected, and there are more than 27,000 cases confirmed, over 1,000 deaths, and then of course we have over 8,000 recoveries in the African continent. And here, as far as the sub-Saharan West African continent are concerned, each has some has higher and some has a smaller number of infections. Like when you look at Benin, their own is still under 100. But when you look at Burkina Faso, it's over 600. When you look at Cameroon, it's over 1,000. When you look at Chad, it's just below 100. When you look at places like Guinea, it's almost getting to 1,000. With us, that's in Guinea-Conakry. But in Guinea-Bissau, it's still lower than 100. When you look at Liberia, Libya, all these ones are the ones that are still in smaller number. But when you take places like Morocco, is getting to about 4,000, and then Nigeria, of course, we have just clicked about 1,000 plus. But when we run down like Sierra Leone and Senegal is still battling also under 1,000, but that of Sierra Leone is a little bit smaller. However, when you come to Nigeria, Nigeria is, of course, one of the largest country in the West African subcontinent. It began about 2 months ago, and through someone that came from Italy in Lagos, and later subsequently it started growing the infection, and by the next 1 month, the officials in Nigeria have taken cognizance of the pandemic world over and tried to mitigate, at least to stop the spread of the COVID-19, and try as well to make sure that measures are taken in the 36 states in Nigeria, with the Federal Capital Territory as the 37. Now, as at yesterday, I mean 26th of April, in Nigeria, we have recorded 1,273 cases. 239 have recovered and discharged. We have 40 deaths in number. And Nigerian government, as said by Sister Yasmina, we have different states with different kind of autonomy. Therefore, every state try to handle the issue through the government and also the executive council of that particular state led by the governor. As I'm talking to you now, it is only in Lagos that the federal government and Abuja that have imposed the total lockdown. But for over a month, all air flights, whether internal or external, sea and road to Nigeria, has been stopped so that the impact will be reduced drastically. Now, what we are doing in Nigeria is to manage the community spread issue. And that before it could be realized, many people who have traveled and landed through Lagos or have landed through Abuja have been able also to go to their home states. Some of those who went to their home state, they are already infected and only being discovered along the line. There are also challenges of even the testing kits here, etc., that have challenged the authorities in actually knowing the status of those who have shown symptoms of being infected. So, like here in Sokoto, up to last week, we have not had any corona infection. Only just last week we had one, and as at today we have 8. And our neighboring state here, Kebbi, just had their own yesterday. And then another state also, a neighboring Austria is Zamfara State. They only had their own also about two days ago. They have 2 cases. So, but situation honestly is not all that palatable, as governments are battling to see how best they can promote the social distancing. And the coming of Ramadan has really made it so challenging to governments. This is because in the Ramadan, we have a lot of activities, and to even ask the followers of the Islamic faith not to do certain things, they may look at it awkward. It has never happened in their life. But the governments, under the advice of the medical personnel, have gone ahead at least to sanction some of the activities they feel will definitely reduce the casualty of coming into of being infected by the COVID-19. For example, many states have imposed border lockdown among their states, and then they have also banned so many activities. Social gatherings have been banned, and then workers have been asked to go back from level 12 down to go back and stay at home. For now, over a month, most of the governments here in Nigeria have instructed that only the senior ones, like the ones on grade level 13 and above, that comes to the office. Now, marriages, celebrations have also been banned, and now our Juma prayer are being observed, and then our Fard prayers are being observed in the mosque, but no Taraweeh and no other Ramadan lectures that we used to conduct in almost every mosque here and many other schools. So that, to a large extent, has also been accepted by majority of the Muslim faithful here. On the other side, those who are not Muslims, like when they celebrated their Easter, the Christians, etc., they have also been asked to do same, and the majority of them have done that. Church services has also been reduced drastically in many parts of the country. But the states where the COVID-19, like the issue of Lagos, in Lagos, because of its higher number, and also Abuja and Kano State. These are the 3 states that are currently in total lockdown. And our governments, in fact, have introduced so many palliatives, not only in Nigeria, but in Niger, in Ghana, in Senegal. A lot of palliatives has been introduced by the government itself. In fact, in many of these countries, the government takes the center stage of doing everything possible to make sure that food is being provided to the public, and also not only food but other concessions, because it has been understood that the impact of this pandemic is affecting almost every sector of the economy, being it air, be it hotels, be it transport, in all ramifications. So a lot of money has been injected. Like in Nigeria, a different kind of arrangement is being done with the banks, and then with issues of the extension of repayment, the issue of injecting 1 trillion, etc., at different forums on different aspects. So the House of Representatives or the National Assembly and the executive are putting heads together to see at least they have provided some, motivation and intercession to ensure that certain things did not collapse completely. So that is what is currently going on. If we look at some states, it has come during the beginning of Ramadan here, mostly in northern part of Nigeria. So now the palliatives or the assistance during Ramadan period, not unlike South Africa, we are still allowed to have the physical contact, but with the with the restriction, like the issue of hand washing, the issue of using sanitizers, the issue of using the face mask. That is what is going on. I'm in the office now talking to you. That's why I could not wear my own. But immediately I'm going out now, I'm going to wear my face mask, and then in every office, in every mosque, in every designation, you find the washing hand drum, and then you also have the sanitizer in hospitals, in almost every place that people gather. This is what is currently going on. Now, with respect to specifically some of the Zakat institutions, I think I've reported in Bandung, and I've also reported in other World Zakat Forum conferences that I even have to take the pain of traveling almost by road to the West African continent to ensure that we know the level of their Zakat institutions. But alas, it is only in Senegal and in Ghana you can find a well-structured Zakat institution. But in other places like Sierra Leone, in Liberia, in Guinea-Conakry, in Gambia, in Togo, in Benin, in Cote d'Ivoire, that have all gone through, they are yet to have. What we try to do is to initiate one. And the second leg of my return to those countries would have been now talking with the authority to commission. In fact, that's why I have the idea that the baznas leadership, like Professor Bambal Sudubio and Dr. Irfan, we intend to arrange a national day of zakat with the president of Senegal. A letter go to Accra in Ghana and then come to Nigeria. A small jawla that will sensitize the Muslims there on the importance of coming together. And we try to invite some of them later to join us. Some few of them attended the World Zakat Forum. So you cannot easily identify Zakat institutions in those countries apart from these two I have mentioned. Talk less of them doing something. But in Nigeria, of course, we are trying to have. We have just been registered with ASWAN, which is called the Association of Zakat Practitioners and Operators in Nigeria. I am the interim acting chairman, and Dr. Aliu Akbahir, a friend to Brother Irfan when they were in Malaysia, who is also a lecturer in Bayero University, Kano, is the secretary. We had meeting yesterday, and we were able to still pursue, even in Nigeria, some states, Zakat institutions are really very weak, but some are very strong. Like the ones we have in Kano, in Lagos, where there is total lockdown. They have been able to raise about 10 million naira, and then to also continue to create awareness. Because here in Africa, we also have some other challenges. Like some people did not even accept that this pandemic of coronavirus exists. Some think it is just an artificial creation of the enemy to destroy Islam and Muslims. Some feel it is just scientifically created uh, to put the world in problem. So for them even to accept this, that this coronavirus is by your doorstep and you must do something to avert its spread and help those who are in need. And the consequences of the coronavirus, whether it is man-made or otherwise, it is felt everywhere. It is ravaging the world. The economy is being also affected in many. And if we didn't realize there is problem now, and there will also be another problem, even if the coronavirus impact has been overcome by the world. So one is now both the Zakat and Waqf in Lagos, Zakat and Waqf in Abuja, and also here at SOZECOM level. What we do is to create awareness that it is real, and this is the consequences of whosoever neglect the presence of this pandemic COVID-19 in our doorstep. Now, the second one, of course, is to provide or assist in some of the preventive, some of the prevention advised by the medical, such as the washing of hands. Now, we provide soap for washing hands, and then we also try to provide the sanitizers. Different group of people produces these sanitizers. Some are purchased and distributed, and some are also purchased and used by ourselves. Then the other aspect also is to provide the face masks. That is also needed because I can remember at the beginning I was in Indonesia. I have asked so many mosques of that so many shops of that face mask. We couldn't get one until when we get Malang. So if as the same thing here in Nigeria, it has not been very readily available. So efforts are being made by some Zakat institutions to give their own contribution. And of course, the food itself, the food, different kind of food distributed. People are in lockdown and it is in Ramadan. So when you ask for donations, people donate in the name of Ramadan, but yet other people donate. Like day before yesterday, I received a call from one of the richest men in Nigeria through some of his aides that they are sending 75 trucks of worth food here in Sokoto State. And I quickly contact the governor, and arrangements are being made to receive that consignment. Other rich men here in Nigeria, like the owners of the cement company of Northern Nigeria, and some of the banks are really assisting. But at the national level, the bankers and the rich have really done very well by contributing in cash or in kind towards billions of naira. There are more than 8 of them that have given about 1 billion naira each, and there are about 2 or 3 of them that gave 2 billion naira, and there are others who gave 50 million, even as low as 100,000. So, but that is being handled by the National Committee under the chairmanship of Alhaji Aliko Dangote. But apart from that, every state from the 36 states in Nigeria, they also have their own fundraising, and people are contributing differently. So the little that comes in the hands are like a Lagos Zakat Sadaka Foundation, and also the one that came to the Jais Foundation in Abuja, and the little that also come to us here, SOZECOM, are now being utilized to assist the local immediately. But remember, it is not now very easy to differentiate between the COVID and also the Ramadan. It is in Ramadan already, so people are giving out. Like even my own state government now, they are giving us worth more than 300 million naira worth food and clothing to be distributed to the poor and also to the orphans throughout Sokoto State. Sokoto State is a state with about 5.7 million people out of over 200 million in Nigeria. So another state is also doing its own arrangement. So I can say in a nutshell that really all concerned institutions, including individuals, have really come out to assist those in need within their their territory. And so far are so good in terms of interventions. But what will happen depends on how Allah has assisted Nigerians to cut down the spread of the COVID-19. There are still some few states that have not had even one case. And many states are having a small number of infected. But in Lagos, that is where we have it now going, almost getting to about 800 or more. And then in Abuja, about 100 and more. So the impact is more on a particular state, that is Lagos. And then the federal capital territory, just like Jakarta or Johannesburg, in but inshallah, we are still meeting. And next week, Sunday, all the Zakat, Waqf, and Waqf practitioners in Nigeria, we are going to have another meeting to evaluate what is going on and then our intervention so far. On the fundraising, which you said, if you have time, you will ask. Definitely, as said by Sister Yasmina, it's not easy to reach out to certain individuals in certain states, especially the rich. And some have already given their large contribution to the federal or to the state governments respectively. But notwithstanding, we have agreed to write letters and seek for donations through online from some of the respected rich in the country, and also those who have that can afford to assist others, inshallah. So far that is what we are doing here in Nigeria. And I can say so far so good. With the help of Allah, inshallah, we'll be able to do more to the poor even after the COVID-19, as it's one of our primary responsibility. Thank you very much.
Okay, thank you. So, Brother Lawal, that's very interesting story because in several states the number of cases are very high, but the other states the number of cases is quite low. Even there is a state without any cases, right? And then there are people who are really aware and want to donate their money and provide help, but there are people who are ignorant with these cases. They are still going around without any concern that they will be infected or they will give this situation worse. So thank you for the updates.
Yeah.
So now I'm going to go to the questions from the viewers of this video. I will go to my laptop and I will check some questions. So there is one question for Madam Yasmina. The questions is there any specific campaign or zakat mobilizations regarding to the coronavirus in South Africa?
So from SANZAF's point of view, I think what we have done is we've mobilized all our resources to create an awareness around this, to create an awareness around the impact of the virus and the lockdown that was necessary for us to contain the virus in our country and the impact that that is having on our vulnerable communities. So from our side, the plan was to mobilize resources around that. And what we have also done is form collaborations. So the Muslim organizations, some of them mostly community organizations, we formed what we call the South African Muslim COVID-19 Response Task Team. And collectively, we've collected around 60 million from the Muslim community for this response that is needed. And just to mention, not all of the funds collected are zakah funds. In fact, the vast majority of the funds is sadaqah, is lillah funds. And the importance of that is that there's an understanding of the scale of this problem and the scale of the response that is needed. But as Brother Lawal just mentioned, it now coincides also with the month of Ramadan. So what we are starting to see now, our appeals in terms of Zakah advocacy that's happening now is a flow from where we were with the COVID-19 appeals into a situation where people are now starting to come forward with their Zakah monies and wanting that also to be channeled towards the aid that is needed at the moment. So our programs that we have started out with definitely COVID-19, and we will continue with that. But at the same time, we are very conscious and aware of the obligations for Muslims during the month of Ramadan as well.
Okay, so thank you. So there are donations, not only zakat, but sadaqah is quite big that you have received regarding this coronavirus. So move to Brother Lawal. You said earlier that you prepare some letters to the rich people in the Nigeria to respond the COVID-19 situations. Can you elaborate more? Is there any specific strategy to mobilize zakat fund in Nigeria regarding the coronavirus, Brother Lawal?
Now, normally in Nigeria, there are people who are used to the practice of giving out zakah in the month of Ramadan. You see, the issue of knowledge about zakat and the dynamics with respect to zakat in Africa, there is still a lot to do. The traditional way of doing things is still what many stick to. But with the advent of what is happening world over with respect to the organization and administration and management of zakat, we are improving day by day. Therefore, the letters we are writing to some selected group of people to come to the aid of zakat is, for example, now in Lagos, they have exhausted over 10 million. And in Lagos, it is more severe. Well, there are some states without even the index case being recorded. So for them to understand the need to come to the aid of the Lagos through the Zakat and Sadaqah Foundation in Lagos, you have to do a little bit, or you have to do some advocacy. In a federated country like ours, that's the only thing you can do. But the challenge is that we are limited. You cannot travel anywhere. You remain within your state. In some states, even you remain only within your town. You cannot go beyond that. And when you talk of using the internet, it is not everyone that, like in your side, that you even take a taxi through the phone. Here, it is yet to be understood very well because of the level of the development. So really, you have to know someone in a state, or you have to have the correct address of a particular person before your message can reach out to him. And he can only do that in one of the two. Either he sends you money through the bank if he can transfer, or he sends you a food, maybe truck, because it is allowed after a certain protocol that if you are shifting food and medical facilities from one state to another, it is allowed. You could be cleared to really go and deliver wherever you are. But we thank God because His Eminence, the Sultan of Sokoto, who is the leader of the Muslims, have been able to issue a statement through the Nigerian Supreme Council for Islamic Affairs and Jama'at Islam. And that has really made an impact now that in the length and breadth of Nigeria, they now know that there is COVID-19. This COVID-19 is real. The ulama have sat and passed fatwa that these necessary precautions has to be taken care, and it is real. So with this now, from last week to today, it appears that in Nigeria, even the poor of the poorest in the village have accepted that COVID-19 is a serious issue and it's a pandemic, that everybody's cooperation is needed for us to stop it separate, and then also to assist, because some of the calls of His Eminence the Sultan is that you may not bring the money to Zakat institution, whether it is Zakat or Sadaqah. The closest person to you, if you know he is in need, please, at this trying moment of COVID-19, pass that your support to him immediately. For those who cannot, they can channel it through us, or when I say us, I mean Zakat institutions within Nigeria, and then that could be further conveyed to the appropriate quarters of the society, most especially where they are in total lockdown. Because where we are not in total lockdown, we still go to the market, and then we still do certain activities. But in places where there is total lockdown, you can't go anywhere. You remain at home 24 hours.
Okay, so as you said earlier, so there are countries in West Africa. There are countries without strong zakat institutions, and they are now affected also with the coronavirus. So talking about
Yes.
the zakat cross country, how about this notion? Do you think is this possible to send or transfer zakat across the country based on the needed of each country facing the coronavirus?
For now, it is not easy because one, even to transfer money online has its own restriction even before the COVID-19 here in Nigeria, especially when it involves Muslims world over, you know, of so many restrictions. And now that it has happened, it is not easy because of the fear. There is great fear now within the countries here, and everybody is trying to contain. So even in the same country, like now here in Sokoto, if somebody is coming from Abuja or is coming from Lagos where the pandemic is high, he has to be quarantined. And normally now the borders are closed. They are not allowed to come in. They are even advised to stay where they are, not to come until after the COVID-19. So no government, no people, even the locals are not interested to have any guest around them, no matter whatever he brings to them, because they prefer to stay safe rather than to be infected.
Okay. So, okay, thank you, Brother Lau. So move again to Madam Yasmina. What do you think about the idea of the transferring zakat from one country to another based on the need of the each country facing the coronavirus? Is it a way of solutions that maybe we can take to respond to situations?
Yes, I think particularly from where we as member countries of the World Zakat Forum sits, I think as a collective entity, we engage a lot, and so we understand what is going on in the various countries. And I think in actual fact we could do a little bit more of that in coming together and sharing like we are doing now, sharing what is happening. But more importantly, as you were saying, is to have that opportunity to reach out to each other. So if you look at a country like South Africa, where the Muslims is in the minority, and many other African countries perhaps where the need is greater for more funds, as Brother Lawal just mentioned, where the collection of zakah has not been that significant. But we look to our member, World Zakah Forum member countries, Saudi, perhaps the Middle Eastern countries, where the collection of zakah is quite significant. There is that opportunity for us to engage and to talk to each other and to see how that kind of collaboration can happen. Because I think from a humanitarian perspective, zakah is an act of faith and it has no boundaries. And the humanitarian potential of zakah is quite substantial. And so we shouldn't limit that necessarily, to a particular place and time.
Okay, so in your point of view, it is possible to look to transfer zakat from one country to another based on the impact of the coronavirus in each country. So thank you. So we are going to have the last 5 minutes. So in the last 5 minutes, I want to hear from you, Madam Yasmina, your closing statement about the zakat impact or the zakat activities to respond the coronavirus in South Africa, especially. Please.
Yes, so I think it's important to talk about the realignment of priorities. As Zakah management organization and entities in South Africa, many of our partner organizations have done exactly that, where they have realigned their priorities and looked at immediate relief, food security being the major priority, but also basic essentials as we enter into our winter season, you know, the distribution of blankets and mattresses for the homeless, but also forming collaborations, as I mentioned before, and supporting government initiatives. So in terms of SANZAF, with a very coordinated approach with government, where in some provinces we are working closely with the Department of Social Development to assist them with a coordinated distribution to food banks in needy communities and even door-to-door deliveries. But I think the important part for us is, as Muslims in this period and time where we find ourselves in, is that sometimes it is a situation where we feel absolutely in despair. But you know, we must always believe that there's hope, and we must be optimistic that things will get better, because Allah promised us in the Holy Quran, in Surah Ash-Sharh, when He says, فَإِنَّ مَعَ الْأُسْرِ يُسْرًا, verily with difficulty comes ease. And also now in the month of Ramadan, the month of Maghfirah, the month of mercy, we must believe that Allah subhanahu wa ta'ala will shower His mercy upon us. And inshallah, our efforts here, not just ourselves as the South African National Zakat Fund, but many other organizations, if I could mention a few here in South Africa, Islamic Relief, Muslim Hands, Mustadafin, Gift of the Givers, African Muslim Agencies. These are all organizations that are working extremely hard, and we're working together to try and assist what we can from the Muslim community, because the scale of the situation is huge. We have a population of over 55 million, and if you were to think of about 30% of that being impacted, it is millions of people that will need assistance. So inshallah, a collective effort is required.
Thank you. So, Mr. Lawal, can you give your closing statement regarding the zakat activities for the coronavirus impact in Africa?
Well, I join my sister Yasmina in raising our hope that innama al-usri yusra, and with the month of Ramadan, we are still praying to Allah subhanahu wa ta'ala to forgive us, blot out our iniquities, and we believe in Him assisting us through to the end of the COVID-19 as soon as possible. That is very easy in the sight of Allah. Here we are really working hard to see the zakat collected distributed. We have 86 districts under SOZECOM that they have collected zakat, and now we are going to the entire zakat we have collected, inshallah, to distribute it. And at this COVID-19 and also Ramadan. As I've said earlier, the state government is assisting us with another chunk of money for food and clothes, inshallah, to be shared throughout the state. Therefore, it is not an easy task, but inshallah, with the help of Allah, we will be able to go through. And we are hoping with this little efforts we are doing, Allah's mercy and rahmah will continue to be on us and will protect us. I have also learned a lesson that inshallah, after the COVID-19, when it will be easy to travel, there is a need to further, as the Deputy Secretary General of World Zakat Forum, that we cannot in any way ignore the formation of zakat bodies in all the West Africa, wherever the Muslims are, no matter how small they are in number. If the Muslims in South Africa no matter their small number, can have SANZAF that is very strong and is worth emulating anywhere in the world, then there is no reason why the Samson could go. In Uganda, we have the Zakat House. They are doing excellently good in terms of the best of their ability. Now, other parts of the country, even where we have majority Muslims, for example, in Niger Republic, there are over 98% Muslims. If you go to Mali, there are over 98% Muslims. If you go to Burkina Faso, there are over 90 so Muslims. If there are many states that are, countries that are majority Muslims, but yet they don't even have a state or national Zakat institution. Now, what I would like, inshallah, maybe at the next World Zakat Forum, to put this as part of the agenda to see how we can network through the governments and through other individuals who are willing, that we now have sound Zakat institutions that in the case of this nature, God forbid, we can always network and our impact will be so great and will be felt by the Muslims and non-Muslim Ummah. Even the environment will testify that really this number of Muslims with either Zakat or with Waqf have made an impact in the life of people when they are most needed. Therefore, I really hope that
Halo, Brother Lawal. Okay, I think we lost Brother Lawal. So from what he said, we can say that zakat is very important to respond the COVID-19 in Nigeria and West Africa, and the cooperation between Muslim populated countries who has the zakat institution is very pivotal to respond the current situations. So I think we are at the end of the sessions. I would like to say thank you to Madam Yasmina, who are already spending her time in these sessions. Thank you, Madam Yasmina. I hope.
Thank you for the
you can.
opportunity.
Yes.
It was our pleasure to share with you what's happening in South Africa and some of the things that the South African National Zakah Fund is doing. And we want to obviously at this point in time wish all of those organizations who are doing kind of this wonderful work, not just with the COVID-19, but now in the month of Ramadan, all the very best, inshallah.
Thank you, Madam Yasmina. See you again. So for the Basnas TV viewers, that's all of the sessions today. The session about zakat impact on the coronavirus for the Africa. I hope you are joining this session again next week with a different topic. And that's all for me. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.